There's a new spotlight on the challenges that Black women face when it comes to fertility, pregnancy, and overall maternal health. A documentary called Black Motherhood Through the Lens is gaining recognition and awards at film festivals around the country. It focuses on 4 Black women navigating the reproductive health care system here in the United States.
Never thought that at age 28 that I would need to explore alternative reproductive options. I did go to a fertility specialist, and it actually was the worst medical encounter of my entire life.
I fear that during the labor and delivery process, if there's something that doesn't feel right to me and I express that my concern won't be taken seriously. I have read articles about the Black maternal mortality rate in the United States. It was a disparaging number that bothered me.
A lot of people talk about IVF and going to a fertility clinic, and that was not on the table for us because we had no insurance and we were paying out of pocket for all the treatment. Medication was expensive, so sometimes I would have to pay for that prescription out of pocket, which meant maybe we ate ramen noodles.
I think that there's this notion that as a Black woman, as a Black mom, we have to be strong, and being strong is not inclusive of having some sort of mental health crisis. I was on a medication for anxiety and I was on a medication for panic attacks. I would put my medications in a small makeup bag and hide them, and I think that is due to the stigma that is very heavy in the African American community about medication for mental health issues.
Black motherhood.
Black motherhood.
Black motherhood. Black motherhood means
A constant state of vigilance.
raising my daughter with a sense of stability and security, loving without boundaries.
The epitome of strength and vitality of Black women.
And joining me now is documentary filmmaker, photographer, and a 4th-year medical student at Brown University, Ade Ashinubi. Hi.
Hi, how are you?
Thank you for joining us today.
Thanks so much for having me.
The film is just beautifully done. Let's start by talking about how you chose this topic. When did you become interested in this topic?
So for me, I started medical school 4 years ago, and at that time there was a lot of media attention about the Black maternal mortality crisis, which really hit close to home as a Black woman myself. And so at that time, I really wanted to raise awareness about that issue, but I also felt that there was not much awareness being raised about other disparities such as infertility, postpartum mood and anxiety disorders, and so I wanted to create this film to raise awareness about all of those issues impacting Black women when it comes to reproductive health.
How long did it take you to put the film together?
So for me, I started 4 years ago in February, so it took about 2 years to really find everyone, film it, and then, last winter edited it, so I would say about 2 to 3 years total.
And did you shoot it yourself?
I did. I filmed it completely by myself.
Excellent.
So, yes.
Okay, so let's talk about some of the information in there. Black women access fertility treatment at significantly lower numbers than white women.
Yes, that
Why
is
the
true.
disparity?
So that is because, access to IVF can be very expensive. The average cost of IVF is between $12,000 to $17,000, and oftentimes it's not necessarily covered by insurance, so that can be a very large barrier for some women.
And now, as a medical student, have you witnessed what is called medical racism, or have you been aware of any patients or family members that have experienced it?
Yeah, so for me, encountering Black patients, on clinical rotations, I've definitely heard people's negative experiences attributed to being Black or, of a different race, and recounting those experiences, which has definitely been heartbreaking, especially when it comes to women's health as well.
So particularly as it pertains to maternal health care.
Yeah, so for me, just seeing women who have gone to the OBGYN, and having those negative experiences really did impact them. And definitely me going into the medical field and going into emergency medicine, carrying those experiences and really advocating for patients is really important to me for the future.
There have been a lot of studies that doctors often devalue the concerns or medical complaints of Black women.
Yes, that is true. That has been shown via various studies. People have had those personal experiences. And in the film, all 4 women have talked about those experiences when it comes to infertility, when it comes to postpartum mood and anxiety disorders as well.
Talk about, if you will, how social media has eroded some of the stigma around infertility and has enabled Black women's voices to be heard.
So one of my subjects, Ijeoma, she is a blogger and she's an influencer, and she actually talked about her experience with infertility and miscarriage, which really opened the door for other women to talk about their experiences. And in the film, she really talks about how that was really essential to her healing process as well. And so I think those avenues, film, Instagram, really sheds light that people are not alone in those experiences, and that it's actually quite common for people to have miscarriages, to go through infertility. So I think it's really humbling and comforting to know that there are other people out there with those experiences.
And the social media allows people to talk about things that they would not normally have done so before, and find people who have their shared experience.
Yes, that is true. And for me, actually, I knew Ijeoma before, but it was her post that really actually showed me that, oh, this is an experience. Let me reach out to her to see if she'd be willing to be in my film. And so, again, social media opened up the door to have her in my film.
So
yeah.
let's go back and talk about more of the success of the film. Where is it being shown, and talk about some of the honors it's received.
Yes, so far Black Motherhood Through the Lens has been accepted to 7 film festivals. Most recently, the American Public Health Association Film Festival, which was very exciting. It also received an Award of Merit at the Impact Docs Documentary Film Festival last fall, and I'm entering it to some more, so we'll see if there's more good news in the future. So yeah.
Okay, so right now a medical student, one day we'll have you back as doctor.
Yes, very soon, in a couple of months. Very exciting.
Okay, congratulations to you.
Thank you so much.
And thank you for being here to share a little bit about your film.
Thank you so much for having me.
Okay. Stalling the symptoms of Alzheimer's disease. A clinical trial is underway right now in Boston to get ahead of the devastating disease. The challenge is to recruit participants from communities of color.